A very good afternoon to you, ladies and gentlemen, and my medical colleagues. As you know, I launched the Thomas channel last week, last Wednesday to be exact. So this is part 2 of the video. Now I'm sometimes referred to as the wizard because I can pretty much fix everything except IT. I don't know much about computers. Anyway, today's topic is going to be rhinoplasty, or a nose job. Now, if you look at this picture, it's a three-dimensional nose. You see how complicated it is. You're looking at it from here, but you can maybe see the second dimension, but certainly not the third dimension. You see how each one of these sections has to be addressed. And that is the reason why you cannot change this, or just change that, or change this, or change that, because what will happen is it's a domino effect. Everything will come down. So when somebody says, I just want my tip to be done like this, it can't be done, okay? Or this to go in. A rhinoplasty has to be done properly, okay? Now, I will show you in the next slide something that is quite interesting. Look at this. This is the front of the nose. What can you tell? This area is called the radix. This is the dorsum. These are the alar. This is the tip of the nose. Okay? And if you look from the side, the very same nose, see how much different it looks here. This is the alar. This is the tip. This is basically the dorsum, and this is the radix. And if you look from below, a nose should look like an inverted triangle. What I want you to know is these external nares, as they're called, the external openings of the nose, need not be equal, and you can never make them equal. You could go wrong, very wrong, in trying to correct this kind of different shape of the entrance to the nose. Only two people look up your nose, a dog and maybe a cat. Nobody else does look up anybody else's nose. Now, in my hands, a good rhinoplasty will take as long as 3 to 4 hours, just like the masters in rhinoplasty. I consider myself a master rhinoplastic surgeon. Now, take a look at this portion here. In here, there is a piece of cartilage called the septum. Very often it is twisted this way or that way. It's called a deviated septum, in which case you'll have a functional problem as well, which means you may have difficulty in breathing, okay? So a septorhinoplasty is wherein functionally and aesthetically the nose is changed, all right? I was very lucky to train with the best that there is, not like the others in practice right now that may have done one, seen one, or done one, or something like that during the training programs. I did a lot of rhinoplasty, and that's why I'm where I am. Now, if I was to look at the next slide, these gray areas, they represent the bony structure. This is the orbit, nasal bone, the cartilage. You see cartilage? Cartilage is blue in color. This is part of the upper and lower cartilages. And if you look at this from here, you see this curve? That's this part of the nose. They're all supported by cartilage. That's why very often when doing a rhinoplasty, one must take the use of cartilages. The most nearest place I can take cartilage from is from the septum. That is, if it's there. If it is not there, then we take what is known as conchal cartilage or ear cartilage. Or you can use a part of the rib, which is called a costal chondral graft, or a chondral graft from the rib. All right, now, can other things also be used? There are some people out there using lots of implants in the nose. Their idea of having a rhinoplasty is opening of the nose, sticking the implant in there, and that's a rhinoplasty. And that they done in half an hour, 45 minutes, 1 hour. For me to do a really, really good rhinoplasty takes 3 to 4 hours, and that's what most good rhinoplastic surgeons take, because every little thing is important. Not only is it important now, but it's important a year from now, because the stability of the nose depends on several factors. The way it is arranged and repaired, plus scar tissue turns to pull things in this direction, that direction, or this direction. So if you don't counter all those things, then you will not be getting a rhinoplasty. Now, according to a survey done in the US by the American Society of Plastic Surgeons, the Aesthetic Surgery Society, the Cosmetic Surgery Society, all the different societies put together, they found that 85.7% of the people that underwent surgery in general were unhappy. And they looked at the common denominator. The common denominator was picking the surgeon based on fees. There's an old saying, you get what you paid for. Rhinoplasty is a very, very exacting, difficult operation. Looks small, but very difficult. 1 millimeter is 1 foot. So beware, patients, before you jump in and go ahead and do rhinoplasties. Make sure you pick the right surgeon. Now, people have come to me after being operated on 15 times, 16 times, on an average of 4 or 5 times. Was that really necessary? By the time we add all the costs involved in doing multiple surgeries, it's much less than what my fee is. So be smart. Now, going to the next slide. This is in a cadaver. This is the lower lateral cartilage. This is the septum, and this is the opening. And if you look here, lower lateral cartilage, this is the septum, the lower end of the septum, the nasal spine, and all of these can be built up with cartilage, batten grafts, predator grafts, all kinds of grafts. This is the rhinoplasty, before and after. Look at this. I want you to take a look at this from the side. You could hoist a flag on it. It had to be reoperated on. And I was happy to make this happy person very happy. Now look at the same nose, up in the air. What was this person thinking about? Incidentally, this surgeon's idea for rhinoplasty was making a small nick here and shoving in an L-shaped implant. This is done from scratch. That's how it should look like. Take a look at this poor guy, walking around with an implant. The nose almost totally flattened and messed up. Came to me just before his wedding, and there he is. Do you think that looks good? And that's a love of labor, or rather the other way around, a labor of love. Look at this from below. Is this something this poor boy would be happy about? Look at this one here, post-operatively. Sideways. He has a very crooked nose, one of the most difficult and challenging things that there is, and that is post-op. Great result. Here's another look at the same nose, very crooked. This is not for amateurs, people that think that they can do rhinoplasty, seen one, done one, or rather even looked at a video of something and tried to do this. Be very careful. Sometimes what Mother Nature left you with is easier for me to correct than somebody that jumped in and did something. And so, if you want to get a hold of me, this is how you get a hold of me. I'll leave this on the screen for about 30 seconds so you can copy this down. I hope I was able to enlighten you in some ways, at least to think, put your thinking caps on. Go for a second opinion if you wish to. I will be happy to give, gratis, let you have a second opinion with me before you go do something. Because what man does is terrible. What God gives you, I can work with. Of course, even the really bad ones I can work with, but it involves a lot of time. And so, one must be patient. The tip of the nose takes a long time to settle down, especially with Indian noses. So, be prepared for that. Don't be in a big rush. Don't jump from surgery to surgery. Select or choose your surgeon wisely. Thanks for watching. I'm Dr. Mohan Thomas. Until next week, see you.